Hi everybody, welcome to my midpoint presentation. This is about improving primary care providers' knowledge, promotion, and support of breastfeeding in Ohio's Appalachia. The statement of the problem has changed. I started out with really looking at suboptimal breastfeeding rates, and it kind of evolved into specifically the lack of knowledge of primary care providers. So many primary care providers in Ohio's Appalachia do not have enough knowledge or training to provide evidence-based breastfeeding medicine to their mother-baby dyads, which increases suboptimal breastfeeding rates. This is a quote that comes from one of the studies that I looked at for my literature review, and if you can't read it, it's a little small. It says, yeah, and I think that that's the big issue, doctors are trained to deliver your baby, take care of your baby, or, to me, breastfeeding goes along with that. I think that they should have, more knowledge of, what's going on instead of you having to go somewhere else to get your information. And that was some descriptive information given by a woman with the moniker of Sue. It's not her real name. About specifically moms in this area and primary care providers' breastfeeding knowledge. So why is this a problem? Why is primary care providers in Ohio's Appalachia not being able to give their patients evidence-based information a problem? Well, like I said earlier, it increases suboptimal breastfeeding rates, which has been shown in a lot of different literature across the last couple decades to increase infant and maternal morbidity and mortality, and actually more so in the realm of maternal morbidity and mortality has the lion's share of those costs, especially associated with premature death. So we have overall increased healthcare, government, and family costs associated with suboptimal breastfeeding rates, which is particularly of concern here in Ohio's Appalachia, where poverty rates are so incredibly high, and people really struggle to make ends meet. Moms are also not reaching her own breastfeeding goals, and for anybody who's ever been a mother or loves a mother, it is very important to feel like you are taking care of your child the way that you want to take care of your child. And we know through initiation rates that most mothers want to breastfeed, and it's very heartbreaking to work with these mothers that it doesn't work out for one reason or another. They do not blame the system that let them down, they blame themselves. So this affects their health in other ways, particularly with how confident they feel in their mothering and other choices of their mothering. So who is most affected? Several groups are affected, but particularly in my paper, what I'm looking at is the historically low breastfeeders of Ohio's Appalachia. If you can kind of see the state of Ohio here, most of Appalachia is going to be on your eastern side and your southeastern side. I happen to live in Perry County, which is one of the red ones down in the southeastern region. And as you can see, we are one of the ones that have been designated as having a shortage of primary care providers. Overall in Ohio's Appalachia, there's 12 different counties that are designated in that red, and special populations are in kind of the yellowish tan, and that is not only a shortage of primary care providers, but also high Medicaid patients, extremely high. The majority of patients would be qualifying as Medicaid. So we have 5 counties that qualify with that. I will tell you, as somebody who recently had a child and needed lactation support in Perry County, I had to travel an hour in any direction, and I did. I traveled to 3 different counties to receive care. So for somebody who has a lack of transportation and lack of funds, it's going to be pretty impossible. So what is already being done about this problem of primary care providers not having the evidence-based knowledge or skills to really help their patients? There are several things specifically in Ohio that have been done. One is that the Ohio Hospital Association had a big push quite a few years ago to increase the baby-friendly hospital initiative, designated hospitals in Ohio, and it did work. 2 of the hospitals within driving distance of an hour of me have become baby-friendly designated since this. Unfortunately, only one of those is in southeastern Ohio, or the Appalachian region of Ohio. So overall, most women don't have access to a baby-friendly hospital still in this area. The Ohio First Step program was developed by the Hospital Association and the Ohio Department of Health to address the issue that many hospitals don't have the financial means or even the interest of the providers or administration to go full on baby friendly. It is quite a cost associated with that. So they came up with basically an incentive program that every 2 steps of the baby friendly hospital 10 steps that you meet, you get a star. So that is the Ohio First Steps program. And each star, or every 2 steps, has been shown in the research to improve breastfeeding rates and initiation, duration, and exclusivity. Wright State Medical College, I should say, with the Baby Friendly Hospital Initiative and the Ohio First Steps program, part of that curriculum that goes along with it is primary care provider information, education, skills. So it does address that problem specifically within the primary care providers in the hospital. Wright State Medical College, their medical doctor program, this is part of their elective page that I have copy and pasted here. They do have a breastfeeding and human lactation course that is an elective for first year medical students. And one of my mentors actually teaches that class. She also runs the Bright Future Lactation Resource Center, and she has for years offered free lactation education, 45 continuing education credits for any physician that wants to take her course. It's completely free. She also she offers free tuition for any women of color or men of color who want to take her class. So she is a really great resource that we have here in Ohio. She's also a published author of about 20 different publications and books with the Leche League International, so we're very lucky. Ohio University's Doctor of Osteopathy program is particularly taking an interest in improving breastfeeding skills and knowledge among their doctors. For one, it was their study in the Voinovich School of Public Affairs and Health that actually identified the unique barriers that Appalachian women face with breastfeeding. So they don't have a curriculum set up yet. I think they'd be interested in that. They just don't have it yet. But they do have some of their healthcare professionals rotating in an infant feeding specialist office currently to learn more about how issues with birth trauma, issues with that can be fixed osteopathically that affect breastfeeding and infant feeding practices. So some literature review highlights moms report wanting their primary care provider to be more knowledgeable and supportive of breastfeeding. When asked, primary care providers do identify their own gaps in their breastfeeding knowledge, clinical skills, and support. When moms perceive a primary care provider as supportive of breastfeeding, they breastfeed longer and more exclusively. Pediatric primary care providers' office practices surrounding breastfeeding can impact duration and exclusivity of breastfeeding, but not necessarily initiation. And cultural competency is an important aspect of practicing evidence-based breastfeeding medicine, and I would say any medicine. In Ohio's Appalachia, there are specific cultural breastfeeding barriers of which our primary care providers should be aware. This is my Pew's matrix, a little bit about why I chose what I chose here. So my criteria is a scale of 1 to 5, and based on the practicality of the intervention, I really wanted it to be practical, not kind of mythical. So I really chose my criteria based on, could I actually do this? And secondly, would it be effective? I think effective is probably the number one, and then everything else was more practical. My weighted scale was 1 to 5 as well, and it was based on how much a particular criteria would improve the knowledge, support, and promotion of breastfeeding among local primary care providers. So as you can see, I have my initial kind of intervention that I thought about was delivering lactation-specific education and professional resources via fact sheets. This is a very Appalachian, culturally appropriate way. I could make it that way because a lot of our care providers are also Appalachian in origin, and I could kind of tailor it to them. However, I did not find when I did this that it was very effective, and it really wasn't a benefit to the population because for an example, the people at the front desk could receive the fact sheets and throw them away. The physicians or nurse practitioners or physician assistants may never even see these fact sheets, so they may not even get the information. So I decided against that once I did the Pew's matrix here. Another option was create lactation-specific courses and formal education for primary care providers, which I think needs to happen, but it turned out to not be a very practical and not really something that I can do right now in the position that I'm in. So that one kind of got thrown out with the weighted scales. Another one is to encourage primary care provider offices to implement the ABM policy protocol number 14, which specifically deals with having evidence-based practices in a pediatric office. I think this is a really great intervention. I just don't think that it's something, as you can see in the Pews Matrix, that was very feasible. So unfortunately that got thrown out. I do think it would be effective, and I think it would be very beneficial, but it's not very feasible right now, and it's also not very culturally acceptable. It would probably take a little bit more than just a lactation professional MPH student coming in and wanting to make that change. Another one that definitely we do already is empower parents to request more lactation education from their providers. This is a really great benefit to the population because it empowers mothers, which is always important to the family's health. However, it's not very effective, unfortunately. The power I don't want to say struggle, but culture here is that physicians are way up here and mothers are way down here. And it's pretty unanimously understood. So I don't think that it's really making a big difference at this point. And then what ended up winning out is hosting a free evidence-based lactation education course for local primary care providers. I don't know how I'm going to pull that off, but I think that I can. So technical feasibility got a 2, and that was really its lowest score. This is going to be very beneficial. It's very effective because it's continuing education credits. We do live, and currently I'm in a place right now where baby-friendly hospitals that have to maintain this education. I actually do that for one of the hospitals as one of my side jobs. So I do think that there will be an interest, and I do think that the person who will teach the course will be willing and very excited about it. So I'm very excited about it too. I'm just a little nervous. So my selected policy, very plainly here, is to address the problem that many primary care providers in Ohio's Appalachia are unable to provide evidence-based breastfeeding medicine to their mother-baby dyads, which increases suboptimal breastfeeding rates, is to host a free evidence-based lactation education course for local primary care providers. So thank you for hanging in there with me. Very excited to see where this goes, and excited to see all of yours as well. Thank you.